Lateral 3G has amazing features on it. And the way I'll show you this is by starting at the top of the head and then working my way down towards the feet. First, taking a look at the head and the facial features. As you can see here, the patient does blink. I can also control the rate of blinking, whether or not the patient is asleep or lethargic. So here the patient is lethargic or becomes unresponsive. Again, wide open. The patient is also able to sweat, cry, have a runny nose, drooling from the mouth, and from the ears. The patient is also able to urinate. The mouth, the tongue is able to swell, including the larynx. The teeth are also able to clench down as they're having a seizure, as shown here. The patient could be intubated, orally or nasally. Any of our airway adjuncts can be used on this mannequin. However, when you're intubating, you should only use a number 6 ID endotracheal tube only. The ears will also have fluid, and there are also speakers on here as well. This patient will speak, and it can be done through 2 different mechanisms, either by pre-programmed voice or directly through the instructor from another room. For an example, I'll show you some of the vocal features this mannequin has. Going further down, the trachea. You are able to do a surgical airway. There are bilateral carotid pulses. Coming further down here, the chest wall. If you take a look, the chest actually rises. So this mannequin is able to breathe and bring in air into the chest wall. So you have chest rise, and it will do it bilaterally. I can change it so one side will rise, the other side will not. This mannequin also has breath sounds. Gastric tones, gastric distension, it can also be utilized here as well. The arms, a real blood pressure could be taken on the left arm only, with a brachial pulse and a radial pulse as well. Coming onto the right side of the arm here is the patient's medication arm. We also have bilateral femoral, popliteal pulses, and pedal pulses as well. Let's take a look at the electrical components of this mannequin. And now you should see here the ventricular arrhythmia. All clear? All right, I'm watching, and we will have a conversion with this particular, I preset this up for a conversion. The 3G mannequin is unlike any other mannequin you may have used in the past. Probably the biggest difference that you will experience is that this will be in real time. Anticipate changes, think critically, and interact with the patient, the mannequin, just as you would a real patient.